So nko asantemantam Manhyia abaya asabe wo honom no ewra bi akọ ho senka akọ pen apomode ho nsamachi akwan ne din ene hudu fuseni na so wahwe ne nkwa eno na enfoni bi ne nam social media binom ede sobo ebo enyumayefo mo ho anesefo no se wo mani anko ewra ne ho ebra obepie aya asabe ho na so enyumayefo mo wo Manhyia aya asabe ho ne chese sansem na ekoso no nokure bi anim.
The Facebook post showing a video of a broken and teary Hudu Sulemana, husband of the deceased, said in part, quote, Mr. Hudu Sulemana has lost his wife at the Manhyia District Hospital in Kumasi of the Ashanti region today, Monday, May 2nd, 2022. The disheartening part of it being that his wife died as a result of intentional no-nurse syndrome, unquote. In the video, husband of the deceased is heard saying his wife's sugar level was checked every 30 minutes and was asked to buy medications.
30 minutes or check sugar. 30 minutes or check sugar. Everybody say, me say no, or
But the brain behind the post, Isaac Insia Foster, explains why he accuses the hospital of negligence.
Because personally, I was standing right beside a woman and I saw the woman suffering. I saw the woman, he was, I don't know how to put this, his heart was beating faster. So if there was a net around, I think that maybe she or he could report to the doctor in charge so that she could be saved. But unfortunately, there was no around to report to the doctor. So the doctor came late. He couldn't do anything to save the woman.
But management of the Manhyia Government Hospital says the post is misleading and inaccurate. Clinical care coordinator of the hospital, Dr. Michael Opoku, says the deceased, Humu Fuseni, was admitted on the 30th of April and given the needed care before her demise.
The first of the case is that this patient, as I said, was on admission at the emergency department and was given care 24/7. The doctors attended to her, the nurses at the emergency department were also there to also do their bit, including serving medications, checking her vital signs, and ordering for all the necessary labs. And so the assertion that she came, there was no nurse, and she was never attended to and didn't receive the best of care, needed to be treated with the contempt it deserves. This patient had the best of care. She was attended to by our physicians, our nurses at the emergency department.
Medical superintendent of the hospital, Dr. Kamaruddin Koku Hussein, told our news team the uninformed social media comment has demoralized staff.
It is highly demoralizing because, especially when you know that what is written there is not the truth. Your staff are demoralized and then they will be wondering whether the service that we are providing is appreciated by the public.
The Health Services Administrator of the Manhyia Government Hospital, Rosemond Ofuriamanfo, called for public education on the activities of the hospital.
Sometimes we need to educate them on some of these issues. That when you come to a hospital, you don't just pick phones and start videoing people who are bereaved or people who are in pain. Then you move to social media and place it there.
In an interview with husband of the deceased, Hudu Sulemana, he said he doesn't have any issue with the hospital and does not believe there is any problem, as the Facebook post suggests.